Consortium 5-year consolidated plan, and the annual action plans, which are separate documents for the city of Tucson and Piedmont County. So our purposes today, I'm going to share what we've identified as needs and priorities, solicit input into additional needs and priorities. So you have to wait till the end of the meeting, Terry, to know. You can say anything you'd like in the middle of the meeting if you have something you want to add. I'm going to do a quick overview of what's in the plan. Going to go over what the needs are that have been identified and some of the data that supports those needs. Look at the 5-year priorities, and then we'll do input. So, but since it's the choir, you know, if there's something that like stands out to you, or that makes you uncomfortable, or very comfortable, I'd appreciate your just saying so as we go along. Okay, so who knows what the 5-year consolidated plan is? It's the French. Yes.
I do know what it is.
You know what it is. I'm not going to tell you, but I know what it is. So it's the framework for the use of HUD community planning and development funds for the next 5 years. And that's the 5 years beginning July 1st, 2025, because it works with your fiscal year. We use PY because we signify program year allocations, because we are required to account by program year. We don't account by a fiscal year. So we have CDBG, ESG, home, and aqua. Both the city and the county get CDBG and ESG funding. The home funds come to the consortium, and the city of Tucson is the lead agency for the consortium. And then HOPWA is our funds, that entitlement funds that come straight to just the city of Tucson. So alphabet soup, community development block grant, emergency solutions grant, home investment partnerships program, but they ended up actually just calling it home. And then housing opportunities for people with HIV/AIDS, and about the total that we come up with is roughly over the 5 years of the plan is around $70 million over 5 years. So that's not a small sum of money. So nothing to sneeze at anyway. So the other thing that happens in the plan is we identify needs and priorities, and those needs and priorities, the priorities in particular, are key, because anything that you fund during the next 5 years has to address one of the identified priorities. So you can midstream say, oh, we have a new priority, and we want to add that to the plan. And when you do that, you get to do the process over again, which is called a substantial amendment. So you guys are nodding. Like, for those of you who are new to this process, we try to avoid doing substantial amendments because we have to do multiple public meetings and lots of people show up, as you can see, and you know, it's just a big brouhaha, and this is time consuming as the primary reason. So we try and stay as broad as we can when we're setting up the consolidated. So we identify those priorities based on input. There was a survey. Both the city and county did surveys, and we had hundreds and hundreds and hundreds of responses to those surveys. So that's really helpful. And then we did a series of meetings, and then we'll have a public comment period starting in the middle of March. So the elements of the plan, the consultation and citizen participation. Did you guys read the drafts? Did you feel like you were at the Department of Redundancy? Okay, just checking. Right, so yes. So it talks about consultation and citizen participation, goes through like everything that, you know, how many meetings, how many survey responses, all of that. Says it in about 6 different ways in about 10 different places. So we make sure that we do this part. There's a needs assessment, housing, homelessness, non-homeless special populations, and then non-housing community development, which is kind of interesting that our biggest program has the smallest amount of information associated with it. We do the housing market analysis, and then the strategic plan, which is what are our priorities? What are our goals for our funding? So how many people do we think we're gonna help or households will benefit? And then we talk about our strategies to address homelessness in special populations, housing, poverty, and regulatory barriers. People forget that regulatory barriers discussion is in the consolidated plan. And usually it requires that you be talking to somebody other than the people that you normally talk with. So it's something to keep your eyes on. And then the first year of action plan for this 5-year period is part of the consolidated plan. So next year you'll do a new annual action plan, but it'll be set up completely separate from this document. All right. So the annual action plans, this is how we're going to use our money. We plan our activities tying them back to the goals and priorities of the 5-year plan. This here says that our proposed projects and activities will be listed in the public comment draft, but after some discussions earlier today, we landed on we're going to be showing our projects. So there's going to be broad categories in the public comment draft. And basically, the processes are done separately. So the city used the PCHIP, call for projects, and Pima County had a new grant application process this year, but basically it's a competitive proposal process. All right, so what are the identified needs and market conditions? I went back, I had to go back and look at what did it say 5 years ago? Because this, I was like, I really want to see how much worse things got. So, so if we look at rental housing, it's about 32,300 households who are severely cost burdened. I'm not even talk about cost burden anymore because pretty much everybody's cost burden if they have housing costs anymore. So it's just the severe that we look at. And I looked back 5 years, and it was actually more low and moderate income, severely cost burdened renters. And part of me wonders if that's just because we've had an influx of new households who have more income, maybe came with their wealth, and so they're not as challenged in the housing market. Maybe we've seen a decline in the number of, the student population, or the student population is housed more in student housing and less in the market, because the student population does have a big impact on these numbers in Tucson. 15,000, almost 16,000 estimated at risk of eviction. You probably are not surprised by that number. About 52,000 on the waiting list for public and housing choice vouchers, and then over 2,000 low-income households whose children are at risk of lead poisoning because they're living in older housing. And that's in Tucson and Pima County combined. And then on the owner side, you have 20,000 severely cost burdened low income owners, same, and more than half of them are elderly. So, that's where our home repair programs come in. And then about 900 households who are owners who are at risk of child lead poisoning. Homelessness, we had fun trying to get numbers for homelessness. So we have different systems that we look at, but basically, we all know that unsheltered homelessness has become a lot more obvious in the last 5 years. The estimate is about 5,700 people becoming homeless each year. So, and then poverty has been well discussed with the Prosperity Initiative, and brilliant, kind of a brilliant approach to addressing that segment of the population. I'm not gonna bore you with the details there, other than to say, I think there's a couple things that maybe aren't as well pointed out in the prosperity initiative in the background report, and that's the number of people with disabilities who live in poverty is extremely high. So there's a dual vulnerability there. And then the single mother households. I had this conversation with Keith Bentley at U of A, and I'm like, what about single mother households? Why are we talking, more about that population specifically? And he said, we probably should. Yeah. So, okay. What we know, I think, you probably know most of these, this data. I think one of the things that really stood out to me, just kind of given the environment that we're operating in today, is that there's 260,000 in the neighborhood of Pima County residents who have an SMI diagnosis and are on access. 260,000. That's a lot of people. So, just keep that in mind as you, think as we watch to see kind of what happens, that, the state legislature in Arizona allocates a lot of money to SMI housing, but I don't think it's going to be enough to cover any gaps that we might have. And of course, that's a population that's also particularly vulnerable to homelessness. So, something to keep an eye on. And then I think, the other thing that I want to point out, and I think it shows in the people with disabilities, when you look at housing problems and you see that much larger number for households with a 30 to 50% median income. So, I think one of the things that we miss is that public housing and housing choice vouchers target to 30% of the median income and below. Then you have tax credit units that are up at about 60%. Of course, you can have any income as long as it's below that, but the rents are, set at that 60% level. And so we have almost like a no man's land in that 30 to 50% of AMI range. And I think, if you magically come into resources and, you're thinking about targeting, that's a group that has the greatest need, and it's growing. That number was like 62% 5 years ago. So there is a group that's kind of left out, and it's those people who are just kind of in that middle, that middle spot there, the middle of the low income spot. We talked about neighborhoods and communities. We talked about pride zones. We had a great conversation with some of the rural communities who were really talking about, how do we corral resources and deliver those effectively through kind of centralized locations and centralized entities. So it's kind of really a balance between, the Thrive approach, where we're addressing revitalization needs, but also outside of that, looking at how do we increase opportunities outside of our poorest communities and our poorest areas, so that people have some choice other than to be perhaps, forced into certain neighborhoods. And then on the regulatory barrier side, you guys got the joint grant. So Sophia, thank you for sending me the information on that. So, we're talking about all kinds of work to address regulatory barriers with that. So it's going to be, keeping my fingers crossed that, that happens. Oh, I don't know what else to say. So I think the nice thing for you guys in terms of regulatory barriers is that you really got it covered. Whereas in the past, that wasn't so much. It was kind of like, pulling teeth to try and get, development services to agree that, they needed to say the right thing in the consolidated plan, so. Okay, so how the money gets spent in the last 5 years? You can see the Pima County is the purple, City of Tucson is the blue. You see a little more funding in Tucson on public facilities and improvements than Pima County. Public services, everybody kind of, and that's a combination of not, actually it shouldn't be 19%, but it shows as 19%. So something's wrong in my math. Oh, it's 19% of the money after the admin cut. So that makes sense then. Sorry. I'm like, wait a minute, that's not right. And then Pima County, that kind of weight between facilities, public facilities and improvements, Pima County has a kind of a proportionate weighting more towards housing than the City of Tucson. So home funds, last 5 years did 208 new home assisted rental units. 40 homeowners received new housing units, which is pretty impressive in today's marketplace. 325 people got security and utility assistance, and then 160 people or households were helped to buy a home. So, I'm always impressed with the ability to, make home purchase work when costs are as high as they are. So it's pretty impressive. So what are the priorities? We did not make massive changes because, we kind of felt like what worked in the last 5 years was probably going to work in the next 5 years. There's not a lot of ways to categorize things. So both the city and the county are looking at community facilities and improvements. The city, human and public services, the county just calls it public services. When it comes to housing, Tucson saying affordable rental and homeowner housing. The county just focuses their funding on the homeowner units, although if there was home funds, I'm sure that came in for a log tech project and outside of the Tucson limits, that would be an option. And then preventing and reducing homelessness. And then for the city that is the add-on of providing housing and services for people with HIV/AIDS. All right. How's that for quick? Are there any needs that have not been prioritized? Yes.
Is there an issue that the county's priorities don't include affordable rental housing?
So
If there were a home life tech development project and not outside the city, like.
So the home funds are all categorized and fulfilled under the city of Tucson.
That answers my question. Okay.
So yeah, so you can
Yep.
still do it.
Good.
Yes. Yeah, and I think it's just not a priority because there's not that much of it.
Yeah, no, I just wanted to be sure that.
We talk about it.
Once
It's
every
like,
couple of years
we should be building more, rental housing outside of the city limits, but and it's almost impossible. Well, A, you got to get it past the neighbors, and B, it's just incredibly expensive. And yeah. So anything you think that needs to be prioritized or discussed that hasn't been mentioned?
I noticed on the City of Tucson, it has human and public services, and ours is just public services.
Yeah.
What's the difference?
They're the same. They're basically the same thing, but the City of Tucson uses general funds for human services. So we call it human and public services because they kind of cross pollinate. Yeah. And they just like the word better.
Humans.
We don't want.
Well, they're more human.
Community and workforce.
Humane,
no.
more humane than us.
Sure.
Some livestock stay in the county.
Yeah. Where those are.
I mean, is there something that you guys wish you were addressing that, with these funds that, I mean, it's so broad. Yeah. Is there anything you're worried like could come up that you wouldn't be able to do? You both took economic development out.
Curious about one of the previous slides and from a PR standpoint, are we able to show the total number of rental units supported and not just the number of home assisted rental units?
So for the consolidated plan, we talk about just the units that we've assisted. If you have data that shows like we've also, the numbers are much, much higher than that because of like there's these leverage units. That could be meaningful to say, if you have that information, we can
That's
say.
part of this.
Well, we can say, that those 205 units were leveraged with an additional however many, like if you have the data. Yeah, we can say it, but we just have to make sure we distinguish it as leverage.
Yep.
Yeah, because HUD is very direct when they say,
Oh, no.
don't tell us, don't tell us about all the other units, right?
Just curious.
Don't include other money in your plan, don't, just. Cause it's too hard, they can't figure it out.
Yep.
Well, and then you get kind of messed up too, trying to like, was that a home unit? Was that, what was that? All right, so where do we go from here? Public comment period. I think this is actually going to end up being March 11th to April 10th, because I keep going back and counting and feeling like it's not a full 30 days. So I'm gonna count again. And then we'll have the plans posted on the city and county website, and we will open up the public comment period. It stays open for 30 days. So comments go to Andrew and to Joel. And then when those comments come in, we powwow if anything does come in. And we say, what is going to be our response to those comments? Because the final plan itself has to include the comments that came in and the response to each of the comments. And then if you reject, like somebody makes a recommendation and you reject their recommendation, then you have to provide the rationale for rejecting their recommendation. So we do that. Public hearings, April 15th, Board of Supervisors, April 22nd, Mayor and Council. And then once we know how much money we're getting, we'll update the documents to show the actual allocations. We'll mess with the funding to the activities, however we need to do that to make it pencil. And then we submit it to HUD. May 15th is the typical deadline. I don't think we will be there because we don't have a budget at the federal level yet. So it can happen. I mean, it could happen that we get a quick budget and and HUD's really fast with calculating the allocations. Terry's over there going, nah. Last year it happened like May 8th. I mean, it was, so we were actually, most people were able to submit pretty close to on time. HUD has a 45-day review window. What that used to mean was that they had 45 days to let you know if there was a problem, and then you corrected that, and then they approved your plan. And if they didn't do anything in those 45 days, then you were automatically approved. Last year, they just kind of left things open and sent comments when they sent comments. And I don't know if you guys you weren't there. Did you have anything last year, or were they okay? I had one client who like 60 days in got comments, and I'm like, it's 45 days was 15 days ago. And they just said, and it's still open, and we're not, you have to explain, there was something I wanted to explain, but. So, it can take, it just kind of depends, I think, on, what the flavor is there. Yeah,
I talked to city at NCEA a few weeks ago, and that happened to them last year, and they just, had the city attorney called the
uh-huh,
HUD CBD office and forced it to be approved. And they weren't going to bother with answering all the comments that they received late. And to me, I mean, that's to the letter of law, that's right. But
Right.
you can risk burning your bridge and your
Right.
good relationship with your local HUD office. So there's a balancing act there, I think.
yeah, and it's like the comment, now that I'm thinking, so the comment that this jurisdiction got back to county. Very rural, very, mix of rural urban, but the rural is very rural. And it was kind of like, well, you say there's a need for all these services in rural areas, then why aren't you funding that? Like, for all 5 people who live there, like, so, but yeah, it was, so we just answered it. We were like, well, let's answer that because, well, there's not enough volume to support a program, right? But
Is that 45-day automatic approval, is that written in statute?
it's statutory.
Okay, it's likely not gonna be a lot of people to review all these plans.
Right. Yeah, so usually they don't look for stuff like that. They they're really looking like, did you fulfill all of your obligations? Is everything filled in?
Yep.
Do the numbers add up? Did you do your math right? Yeah. And then the grant agreements should come sometime in fall. They used to come earlier, now they come in fall. I don't know, maybe things will be more efficient this year. Or next. All right. Any other comments? All right. Thank you.
Thank you, Martina.
We only almost needed hammocks. I'm like, you guys have seen all of this, it's not, So thank you.
Now we're off the record.